and welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi, and today I'm very excited for our guest. We will be bringing on Dr. Sophia Yen, who is the co-founder and CEO of Pandia Health. As you know, we love questions here at Women's Health Tech Wednesdays. So throughout our conversation, if you have any for Sophia, please use the Q&A feature at the bottom of your screen, and I'll make sure we save some time at the end to get to it. And so with that, we'd like to formally bring on our guest, Sophia. Hi, Sophia. Thanks so much for being here.
Thank you so much for having me here today.
So excited to learn a little bit more about yourself and, of course, of Pandia Health. But as this is Women's Health Tech Wednesdays, the first question I have to ask you is, what does women's health tech mean to you?
Women's health tech obviously is specific to women and health technology that benefits only women or preferentially women. So related to menopause, to anything to do with the uterus, vagina, the vulva, breasts, and any kind of health conditions that are more likely to hit women than men.
Love that. Nice, short and sweet. So before we kind of jump in and kind of get into your background, I, of course, saw the TEDx talk. And I think the coolest thing about that not only was the information, but your condom bag. Would love if you could just share, what sparked you to kind of come on stage with a bag that had a bunch of condoms on it.
I think it's always important to make an impression to stand out when there is a sea of many different companies out there. And so, as I like to say, I am the only CEO you're probably going to see with a uterus necklace, a condom bag, and sometimes a beaver ring. And so I'm pretty, and a uterus. So take all that together. I dare any other CEO to have all of those.
I love that. That's just a great general life and business tip. Always do something to catch people's eye. I love that. Awesome.
And it starts conversation. So I'm running through the airport, or I'm at a concert, or I'm at a conference. People look at me and they're like, and I'm like, yeah, that's what you think it is. Let's have a discussion. And it gets, always be closing.
That is amazing. I need to steal that just as a general life hack. I love it. So would love if you could share a little bit more about, who you are, your background, and really what inspired you to create a company, Pandia Health.
So as my mom said, claim all your titles. So, Asian mom, have to say I'm Dr. Sophia Yen. Went to MIT, UCSF, one of the top medical schools in the nation, then Children's Oakland to be a pediatrician, then back to UC San Francisco to focus on adolescents and young adults, what we call sex, drugs, rock and roll, a little acne, some sports medicine, and then had to get all the degrees in the Bay Area. So went to Berkeley, go Bears, got my master's of public health and maternal child health, focusing on obesity, and then finally ended up at Stanford, where I'm a clinical associate professor in the Department of Pediatrics in the Division of Adolescent Medicine. And about 8 years ago, was giving a lecture to a bunch of physicians. Why don't women take their birth control? And one of the top reasons why women didn't take their birth control, didn't have it in their hand. And it was the beginning of Etsy and eBay and just everything coming in the mail. And my friend Pearl Annie and I looked at each other and were like, we can solve this. We will just ship women birth control. Keep shipping it to them until they tell us to stop. It will rain from the sky. We then ran ads, free birth control delivery, and 60% of the women that responded didn't have a prescription. And it's like, don't you know in the United States, you need a prescription? Maybe in China and other countries you don't, but in the US of A, you need a prescription. And as an entrepreneur, I didn't want to run ads where 60% of my ads were useless. And as a doctor, I could write prescriptions. And thus Pandia Health was born, the end-to-end solution for evidence-based quality healthcare for women online, for low-risk recurrent medications. If you need a doctor's appointment, just $20 once a year to use our expert evidence-based doctors. And then if you already have a prescription, and thank you, Obama, Biden, and the Affordable Care Act, no copay, no deductible under the Affordable Care Act for any FDA-approved birth control method, as long as you don't insist on brand when there's a generic available or whatever is preferred by your insurance. Then if you have a prescription by your doctor and insurance, you pay us nothing. And if you have no insurance, it's roughly $15 per pack of pills for the good stuff. That's my new hashtag, get the good stuff. Don't skimp on your care. There is a $7 pack, but that's best for Caucasian females that want to bleed every month. But for everybody else, if it were me, my daughter, my friend, I'd do the $15 one.
Got it. Number one, the visual of it raining birth control, I think, is my new favorite thing to think about today. I love that. And so for you, I mean, I think, especially now, just accessibility to contraception is completely paramount. So I love what you're doing. And I love that this was something that you noticed, even earlier on. So for Pandia Health, do you primarily focus on contraceptive prescriptions, or do you also kind of tackle maybe some other women's health tech concerns, UTI, yeast infections, etc.?
Perfect question. This has always been about empowering women. We specifically chose the name Pandia because she's a Greek goddess of healing, light, full moon. We went through all of the goddesses, and only till we hit letter P did we find one whose website wasn't already taken and whose mission fit where we wanted to go. And then I made up the definition. Pan is every and dia is day. So our goal is to be with you every day from 14 and a half, 2 years after your first period, throughout your period life. But now I'm of menopause age. So all my friends are like, menopause, menopause, menopause. And I'm like, yes, I will find the best menopause treatment for me. And then I will share it with all of you. And then if you don't want the best, then I'll give you the other alternatives. But, we treat everybody here the way we would want to be treated, the way we'd want our family members treated. And I have 2 daughters. I made this company make my life better, but I also made this company for my 2 daughters and anybody else with a uterus and vagina and other body parts that we'll be servicing. So we're starting with birth control. We're adding on menopause January, February of next year. We've soft launched acne. And just FYI, anything a doctor can prescribe beats anything over the counter for acne. And then we're also going to launch sexually transmitted infection testing this in 2 weeks in honor of September, Sexual Health Awareness Month.
Very, very cool. Wow. So big plans. I love to hear it. But before I continue, there was something that you said that sparked something for me. You had kind of mentioned with some birth control, you had mentioned like this would be good for Caucasian women. Would love if you could share, because I think this is an area where there's not a lot of awareness into, does race play a role in the contraception options that are available to you? So curious about that.
So every option is open to everyone, but I learned that what I was taught at UCSF and Stanford works great for a Caucasian female that wants to bleed every single month. But when I went into this, I realized in retrospect, I had to go through 3 different birth control pills to find one that worked for me. And then when I spoke to other providers, they're like, yeah, for Asians and for Blacks, what we were taught at UCSF and Stanford doesn't work. And so then I, using my MIT Stanford brain, took an Excel spreadsheet, studied the 8 different progesterones, the 40 different birth control pills, and ranked them from least likely to give you munchies to most likely to give you munchies. Least likely to give you breakthrough bleeding, most likely to give you munchies. And at Pandia Health, we have a proprietary algorithm that, based on your age, your BMI, and race as a proxy for genetics, which birth control pill will start people out on. And generally, when people start the birth control pill, only 55% continue at a year. We have an 82% continuation rate.
Wow.
And once you get side effects, we know how to tweak it up, tweak it down according to this ranking of the 40 different birth control pills on these different side effects.
That is, that Excel, I think, is gold in general. But I love that. So is there something kind of in your platform dashboard where women kind of can track their symptoms over time to see if there are any like changes that need to be made? Is that something that's very cool?
So yeah, we have a built-in follow-up at 10 weeks for anybody who's new to a medication. So if you're already on a pill you like, we're not going to change you. But if you have any issues or you're open to changing or whatever, then we're going to, suggest the one that we believe that will result in the least amount of side effects for you. And then at 10 weeks, we're like, are you having any side effects? And if you are, then we can readjust. And we allow our physicians to schedule as unlimited follow-ups because they didn't want anybody stopping birth control because they had side effects or they couldn't afford the follow-up. So free unlimited follow-ups for 364 days of any question you have about birth control, not about other health issues because you only paid $20.
That I think is so smart. And I love the fact about accessibility, especially when you are trying something. And I feel like when you first start on birth control, it's almost like you're casually dating. You're not committed yet. So you really want to make sure that it's very easy and there's not a lot of, I think, even shame around switching up birth control. I feel like I would say, just from what I've heard, with the work that I do, there is a lot of like embarrassment. Like, I feel bad. They already put me on one type of birth control. I don't want to like switch it and be too much of a hassle. So I love that you're just taking all of that out of the equation.
Yeah, we like to call that Pandia PSA, public service announcement.
Nice.
You don't need to have any side effects on birth control. And there are 40 different pills out there. So that's a really important fact that I want to get out there is not all pills are made the same. There are 40 different pills and one clinical pearl, another Pandia PSA. I like to use my Facebook and other social media to get out health info. So feel free, everybody, to post your Pandia PSAs today. That if you're under 30 years of age, we generally recommend at least 30 micrograms of estrogen because there are a lot of physicians who, all I've done for the past 6 years is birth control. Whereas other doctors, birth control is one of 100 different things they have to deal with. So they don't have the scientific brain focusing on this. They aren't doing this 24/7, which is what I'm doing. And so they don't know that I'm adolescent medicine, so we care about your bone health, that you need at least 30 micrograms of estrogen until you're 30, unless there's extenuating circumstances or whatnot. Otherwise, it's not good for your bone health.
That is very, very good to know. Wow, so many nuggets of wisdom I'm getting from this conversation. I want to keep this train going. I think kind of just leveraging your expertise from not only an MD perspective, but from an MPH perspective as well. Definitely have a couple of questions around contraceptive, but I would like for us to maybe start big and then funnel down. But for you, just, leveraging just your experience and just, the time that you've spent in this space, what does the future of medicine or the future, I could even bring this down, what does the future of women's health look like to you? Or where do you want it to go?
I think there is still so much funding we need for women's research. We need to mandate that every study have at least 50% women. I, as a researcher, totally understand the fear and the liability of including women in research studies, because if they get pregnant, then there's all sorts of, crazy liability. And people are also, the more variables in the equation, the harder it is to analyze the situation. And so if a woman is naturally cycling, then her hormones are going up and down, up and down, up and down. If she's on the birth control pill, patch ring, depending how she's taking it, though, we advise the option of #periods optional, which is just keep a continuous hormone level, makes your life better, makes your emotion better, is better for diabetes, is better for seizure disorder, is better for emotion and stuff. But if you do 3 weeks on and 1 week off where you bleed, that artificial withdrawal bleed, that is a hormonal change. And it's just harder for researchers. So I totally get it, but we need the research. We need to do that analysis. We need to do studies just focused on women. And then as a person, a minority, we need research by not just Asian, because there's so many sub-Asian, right? Filipino is not the same as Japanese, is not the same as Thai, is not the same as Vietnamese. It is Korean, it's different. And so we cannot just stick us all in one, but, to the best of your ability. And then, not just African descent, but where, and just, take the subcategories and then group them as necessary. So we need research in, so many other health conditions, menopause. There's still so many drugs that could be developed there. And it's silly that we have to take our estrogen and progesterone separately for menopause, and that is not the optimal treatment. Why can't you put the two in one patch? Why can't you put the two in one IUD? Why can't you put they do have the two in one pill, but it's not the best ones. I want 40 different options for that one as well. And then I also, on the policy side, we need to cover menopause medications just like we cover birth control. And I'm calling that V2 as in version 2, but also vagina 2. So vagina 1 or version 1 was, any FDA approved birth control, no copay, no deductible. And same thing should be any FDA approved menopause treatment should be no copay, no deductible. It's just logical. And if you don't do it, then you're ageist and sexist.
I wholeheartedly agree with everything you just said. And I love that you took it in so many directions, from the research, from the policy. I think you really just showcased how big, or I'll be nice, how big the opportunity is for change in all of these different areas. And I think especially kind of calling out how there needs to be a lot more support just from women's life, from from when she's born to when she dies, the entire thing. There shouldn't just be, a specific area or phase of life that is given more attention than the others. So I think that is incredible. Also, I know we are at 10 and we actually have a couple of questions. So let me just take some time before I forget, because I'm just going to keep on going here. So we had a question that is around the work that you do for Pandia Health. Is there anything that you offer in terms of post-conception healthcare, including termination of pregnancy at this point?
So yeah, right now we are about preventing unplanned pregnancy. If you want to get pregnant, then there are lots of other companies that specialize in fertility, but I also notice termination of pregnancy. I want to make another Pandia PSA here, is that know that emergency contraception, and know that there are 4 different emergency contraceptions. So a PSA within a PSA within a PSA. The IUD, copper IUD, is the most effective emergency contraception. And if it were me, my daughter, my friend that was sexually assaulted, and we wanted the lowest possible chance of being impregnated by my rapist, I would go to the ER, an academic ER, where there's an OB-GYN on call 24/7, and be like, throw down that copper IUD. Because there is a 0.00001% chance of being impregnated if you throw down a copper IUD within 5 days of a sexual assault. Then comes the hormonal ID, then comes prescription emergency contraception. And I have my thing here, Ella. I don't get paid by them. I just want people not to get pregnant. Know that this is prescription. And if your doctor prescribes it, again, if you have insurance, no copay, no deductible, aka free. You can also ask for the one with the farthest expiration date. And that's the difference between Pandia Health and other places. We write in our prescription, please give the patient the one with the farthest expiration date. But if your doctor doesn't know that, you walk in and you're like, hey, this one expires this week. And it's because they thought you were going to use it today, which is fine. But don't leave the pharmacy. Be like, no, I want the one with the 2-year expiration date. And they're like, well, we don't have one. You're like, I can wait. I'll wait, come back tomorrow, because it's not a hurry for me, because it's for future. And then comes Plan B, and it's generics. And then if you're in the middle of nowhere, you can look it up. And if you have levonorgestrel and norgestrel, you generally can take 4 pills now, 4 in 12 hours. But this is from most effective to least effective. This is if you don't have a positive pregnancy test. This is up to 5 days after contraceptive failure or sexual assault. But as I tell my patients and anybody who's heard my voice or heard my talk, if the condom pops at 3 a.m., I want the medicine in the person with the uterus's mouth at 3:10. I do not want any cuddling, huddling, waiting till the morning after, waiting till 5 days, because you did hear me say 5 days. 5 days is for your friend who shows up on day 3 and it's like, oh my goodness, the condom popped 3 days ago. What can I do? And you'd be like, here, Ella. So do not confuse emergency contraception with medication abortion. So there's Plan A, your regular plan, Plan B, which is, brilliant naming of it, but I would do IUD or Ella. And then Plan C, which is my other friend's website, nonprofit, totally trust it, plancpills.org. And it tells you anything you could possibly want to know about medication abortion It lists all the telemedicine companies. You can list it from closest or cheapest. It's roughly $105, and that too you can get ahead of time. And my friend's radical proposal there is, in a state where abortion is illegal, if you miss a period, don't check a pregnancy test, just take the medicine and make your period regular. There was no abortion involved. If you take medication abortion and you show up in an emergency room, there is no way to tell the difference between a spontaneous abortion, aka miscarriage, which happens to a ton of women and we just don't talk about it, or we just don't know about it, and medication abortion. There is no difference between the two, except with medication abortion, we sometimes advise women to take the second dose of medicine in their vagina because there's fewer side effects. But if you are in a highly anti-women, anti-reproductive rights, anti-bodily autonomy, anti-freedom of religion state, do not put it in your vagina, because sometimes the tablets don't dissolve. And if they find that, then yes, you can tell the difference between a miscarriage, spontaneous abortion, and a medication abortion. Do the one in the mouth.
God, wow. Okay. Incredible information. Everyone, this will be recorded, so you can look back on this because this is amazing. We actually had another question, I think in the same vein. I'm just going to read the entire question here. After the Supreme Court overturned Roe v. Wade and gave states license to ban abortion, it also increased the likelihood that many contraception methods like birth control pills and Plan B could be targeted next. How are companies like yours reacting to that? Are you engaging in some kind of collective action?
So the hard part about American law is somebody has to be hurt before you can take any action. And so we, as a community, I believe, have always been trying to find someone of the Jewish faith, because their faith says if the person who's here and now over the host, it has rights over the visitor who has taken over the body and is trying to claim rights to you. And therefore, if your life or health is at risk, then it is your religious duty to terminate in the Jewish faith. But we have to find someone of that faith in that state who's willing to not get an abortion or termination, risk her health and life to fight it. And it's so sad that someone has to die or get hurt before we can fix it, or we have to elect people that respect religious freedom, because I believe we should frame this as religious freedom. Your uterus, your decision. My uterus, my decision. No uterus, no say. You have every right to try to convince me to go one way or the other, but to force your religion on me is absolutely un-American. And the example I give is my mom's Buddhist, and you would not want her running this country, because we'd all have to be vegetarian. And then sometimes you couldn't build a house during rainy season because you would kill a worm or an ant. So don't let one religion dominate. This country is about freedom of religion, and you have every right to try to push your religion verbally, but to mandate me to follow your religion is absolutely un-American. And then another point that I thought was impressive is a dead body has more rights than a person with a uterus right now. You can't, when you're dead, be forced to give away any of your organs. We all know in the donor organ thing, you got to check it before you die, because once you're dead, they can't touch it. But if the state deems it has an interest in a 4-cell, 8-cell thing growing in my body, that is, and they're making no exceptions for incest and rape, but even then I should have bodily autonomy and not require a violation of my body before I have the right to bodily autonomy.
Absolutely. And it's one of those things where I always find it so disappointing that women's health is something that needs to be politicized. This should not be a political topic. This is our health. This is healthcare. So I really love, I think all of these questions were incredible. Thank you to our audience. But I mean, I think the work that just really speaks to the work that you're doing and how you're really trying to make it easy, accessible, affordable, democratize just these options so that women feel like they have options here and they don't feel like, they're alone when it comes to managing and empowering their reproductive health. I see that we're actually at time. Wow, that flew by, Sophia. Quick question, just to kind of wrap things up. Would love if you could just end it by just sharing a piece of advice that you have received that you want to share forward with our our community. That's typically how we like to end our conversations.
Well, I would like to say, buyer beware and get the good stuff. Know that not all telemedicine or companies and startups are made the same. Look at who the founders are, look at who the CEOs are. As I like to say, I am one of the few CEOs that has taken an oath, do no harm. And at my company, we will always tell you what's best for your health, even if it doesn't benefit our bottom line. But to the investors, I will absolutely make money, but I won't do it pushing something that is not in the patient's best interest. And so you want the smartest and the brightest taking care of your health. Don't skimp on your health.
Amazing. I love that. Great final words to end by. Thank you so much for taking the time to chat with us today. What an enlightening conversation. I really appreciate it. Just to let everyone know, we do have a symposium at the end of the month, so please be sure to check that out. If you're interested, the registration information is in the chat. We also are going to be releasing these webinar episodes in our podcast, so be sure to check that out. Want to thank our sponsors, Goodwin and Rhythm, for sponsoring our amazing conversation. And of course, one last huge shout out to Dr. Sophia Yen, CEO and co-founder of Pandia Health, for the amazing conversation. We will see you all next week for another Women's Health Tech Wednesday. Bye, everyone.